So I grew up in southeast Oklahoma, about 2 hours south of here. Had one sister. She was about 6 years younger than me. And my parents both grew up in southeast Oklahoma. And we lived out in the country, and the things that I liked to do and do with my dad was we went hunting and fishing and camping, and it was a setting not unlike where I live right now. The outdoor activities were the primary focus of what we did as a family. Well, Darla and I are a blended family. We were each married before, and we have children from previous marriages. Jill is my oldest. She is my stepdaughter, but I don't think ever was my stepdaughter because I've raised her since she was 6. And Jill is someone I'm extremely proud of. She's come a long way in life. And right now, Jill is pursuing a degree in business at University of Arkansas. She works hard. She's a very honest and good person with a tremendous heart. And she is going to become so much more than she ever thought she was going to be. And she's just a sweet, tender person. I'm so proud to be her dad. My youngest girl, her name is Nikki. Nikki has been going to University of Arkansas, and she's changed her major a couple of times, and she's taken some time out to do some work. But Nikki's another one who has a big heart, and she's sweet at her core, and she works hard, and she's persistent when she gets started at things. And she's another child that I'm extremely proud of for all that she's been through and all she's had to endure, because they both lost their middle sister. Ellie was my firstborn from a previous marriage, and little Ellie got sick when she was about 8 months old, and she was sick all her life with a very rare illness where her immune system attacked her body and tried to reject her own organs. And it was a fight keeping her alive for the 21 years that she was alive. And it was very traumatic for these two girls to have to see her be sick and have to watch her go through the struggles that she did. It was very hard on them when she passed away. But her life changed Jill's for the better. And it truly made Jill grow up and focus on what was important to her. And it was shocking to the core for Nikki, because that's all she'd ever known was her sister. And she's still getting over it. But she also learned the important things in life. And she learned that family comes number one, and don't ever take them for granted, because they may not always be here tomorrow. When I was 5, I lost my grandfather. And he was just my best buddy. He died suddenly. He had been sick for a long time with other medical problems, but he died of vascular disease. And at the time, I didn't know what that was, and I don't think that really most of my family knew what that was, and that's what bothered me. It wasn't the loss. It was the loss of not knowing why. And that really dug at me. I lost my grandmother when I was 11. And they were my best buddies. They were my closest relatives. And to lose both of them in such a short period of time, both of them from causes that really weren't deeply understood by everybody in the family, that bothered me a lot. And I learned later on in life what those things were that caused their deaths, but it inspired me at that time to want to know why. So when people became ill, I wanted to know why it was that way. And it inspired me to dig deeper in science, and it inspired me to dig deeper into life sciences. And starting at about the age of 14, that's all I've ever wanted to do. My greatest hero was the physician who delivered me. he was my greatest inspiration in that he was steady, he was always there, he was very knowledgeable, he was fearless. He had done everything at a time when there weren't that many specialists around. And I've always looked up to him and always looked at him as a model to pattern myself after. When I started medical school in '84, there weren't any computers to speak of. Everything was about patient interaction, about sitting down, getting very personal with the patient, connecting with them, and getting the history and physical from them to make the diagnosis, and to actually being involved with them personally because you're their physician. We were taught early on, you are the final responsible one. It's not the nurse's patients. It's not anybody else's patients but yours. And so ultimately, the only person that's really looking out for them is you. And that stuck with me from the very beginning. And that's how we were trained. And we were trained to focus on taking care of the patient, focus on figuring out what was wrong, and then doing something about it. And at the time, it was you did whatever you had to do to save the patient, period. And in 1992, when I started practicing Fort Smith, that was still the focus. The focus was still on the patient. We didn't have computerized medical records. We didn't have a tremendous amount of involvement with the federal government or with insurance companies, and we could do what we were trained to do. We were trained to see people, document what we had seen and what we did succinctly, and put it in a way so that the next physician who came by, if there was an emergency, could review the chart and quickly glean what he needed to make a diagnosis and help the patient. Now, transition from 1992 to 2015. It's all changed. Everything is driven by money. And it's all driven by federal government needing to save money on a Medicare program that's not fully funded. Insurance companies that are trying to stay solvent in a system that's not working. And so everything that's driven in medicine right now is saving money. And all of the systems set up to support that network are geared towards that, including the medical record, the billing systems, the whole medical infrastructure is set up that way. We've now become the most regulated industry in the United States. When I was younger back in 1992 and I had little kids, I had time I could go take them to school in the morning and then drive to work and make rounds, maybe starting at 8 o'clock. And in a day, see 40 people and take care of them. And at the end of the day, I was done at 5:30 or 6 and was able to go home. Now, in order to keep up with the paperwork that's involved, my day starts about 6:30 and I get home about 7:30, and it is a dead run from the start of the day till the very end. The primary reason that I'm changing is because I don't want to be answerable to the government or an insurance company every day on how many I see and how I treat them. I want to be answerable directly to the patient. And the only way I'm going to do that is have time to spend with them. And the only way I'm going to be able to work through all of the hoops that you have to do in order to get the patient to what I need them is to have more time with them. And so the main reason I'm making this change is so that I have more patient-driven time, more patient-focused time, and less government or insurance-focused time. I didn't go into medicine to sit in front of a computer and enter data. And I didn't go into medicine to make the federal government or an insurance company happy. I went into medicine to make people well. So because the practice is limited, because it's closed, there's a limited number of people and there's more time for you. If your appointment's at 10 o'clock, you're going to get seen at 10. And when we're sitting there talking and we've dealt with all the problems that you've brought in on your list, there's going to be plenty of time for me to sit back and look at you and go, so, what else is going on? And you're not going to be used to it, but you're going to love it. The biggest benefit to the patients in this model, and it is just a different model of paying your doctor. In this model, you're in a closed practice. Instead of a wide open practice, which is what most patients are used to, where doctors are always taking new patients forever, and the practice gets bigger and bigger, and the waiting room gets busier and busier, and you basically become smaller and smaller to the doctor. In this style of practice, you don't change. You become like family. The practice is small enough that I can not only know you as a patient from what I see in the chart, I can know you. I've got time to sit and talk to you and listen to the things that you tell me that you didn't even know were important. Things that you tell me that I didn't know was going to be important because I've got more time. I'm going to hear things that you're going to tell me about your family history and about the things you do during your day that I simply hadn't had time to do in the past. And it's going to help me make diagnoses quicker and cheaper than previous. Whereas it may have taken more testing in the past, I'm just going to get to spend more time, and you're mostly going to end up telling me what's wrong with you. As far as the time that you're going to have in access to me, it's going to be more than you've ever had with any physician before. In the past, patients, if they called in after hours, called an answering service. Or they called someplace that beeped the doctor and he called back somewhere. You're going to have direct access to me on my cell phone. If you want to text me, you can text me. If you want to call me, you can call me 24 hours a day. If you need to send me an email, you can send me an email directly. There's not going to be any barrier between you and me. That is the number one reason I'm going into this, is because I'm sick and tired of the barriers between patients and doctors. I don't want a barrier between you and me because I didn't go into this for any other reason except taking care of sick people. I lost my grandfather when I was 5. It was a very emotional event that drove me into the practice of medicine. I lost my grandmother when I was 11, and that pretty much set it in my heart so that by 14 I knew that's what I wanted to do. Well, when I lost Ellie in 2011, it made me realize that for some people, they need to have a physician who knows their case so deeply that it's like being a person in the family. When Ellie had her disease, it was a disease that is literally a 1 in 10 million incidence illness. 1 in 10 million people. And with the number of different problems that she had associated with it, it ended up being more like 1 in 100 million. She had so many things that had to be managed. And we would take her to physicians and try to just get her a primary care pediatrician, and they would just be scared to death. They would see this disease they'd never even heard of and all these different problems that you had to manage as a part of it, and they didn't want to do it. And it took a long time to find anybody that would manage it, and then they didn't even take the time to read about it because they were too busy taking care of a bunch of well kids. And as she got older, it was hard to find even an internist that would do it. So Ellie would see multiple specialists, but nobody was quarterbacking this case. It was Ellie's illness that made me change from going into medicine to be a cardiologist to doing primary care, because I knew there weren't enough general internal medicine physicians to quarterback the cases. And Ellie probably wouldn't have lived to be 21 and has had has a normal life as she had if she hadn't had that personal physician at home, because we couldn't find anybody else. So I got to know Ellie and everything about her illness personally, so that any day I could look at her and tell what was getting ready to happen and what needed to be done about it right then. Because in a case like hers, in somebody who has that many illnesses that young, most of those kids are in the emergency room every week. And most of them don't live to be 5 years old. And they only gave her a 20% chance to be 2. But she lived to be 21, and she got to go to college, and she got to be a cheerleader, and she got to have boyfriends. And if you'd seen her, you'd never even known she'd been sick. But it's because she had her own personal physician. And I didn't even know what concierge medicine was back then. But if there had been one, I'd have hired him so that I didn't have to do it, because it was stressful. And it was hard being this little girl's daddy at the same time being her physician. No person should have to go through that. No person should have to worry constantly, am I going to get sick, so sick I end up in the hospital before the doctor can get me better? Because I kept Ellie out of the hospital thousands of times with things that if I'd had to wait to get in the office or get in the ER with people who didn't know anything about it, she'd have been hospitalized over and over and over and would have died before at age 10. That's what I want to do for other people. I want to do what I did for her and help them stay out of these emergent situations. You are going to be making choices in life every month on where you're going to spend your money. And the amount that you're going to spend doing this is not much different than a cable bill. This model is set up for people who want to be able to access a physician who can take care of their multiple medical problems, older people who need more time spent with them, older people that may be housebound and need a home visit. It may be for people who are into preventive care and they want to come in and they want to spend time with a physician and show them all the things they've read on the internet, or talk to the physician about what's new in medicine now that can prevent me from getting heart disease, and actually spend more than 10 minutes talking about it. And if you want to be able to sit next to the doctor and look on the internet together and read it together, you got time to do it. So you have people who have multiple medical illnesses, severe chronic illnesses, people that really want to do preventive health, people that want to maybe lose weight, and they've tried every other way and they really don't want to go the surgical route, and they just need somebody to coach them through it and be serious with them and sit down and hold them accountable. This is for you, because I'm going to have time to sit with you and tell you point blank what you're doing is not working. And this is exactly what you need to do. I'm going to hold you accountable, and we're going to weigh you as often as we need to do it. And then there's going to be people who are extremely busy, and they simply don't have time to go sit in a waiting room for an hour, or after they've sat in the waiting room for an hour, go sit in another room for another 30 minutes. They need to be able to go to an office visit that's been scheduled, walk in, get it done, and get out. There will be times when someone is in a very busy occupation and they can't get away from their business in order to see me. And it may be that they've got some problem. They actually have an acute problem. Something as simple as bronchitis. Well, if they don't have time to get away and I know they need to see me and it's not something I can take care of on the phone, I'll have time to actually drive over there and see them at their place of business and examine them in their office if I need to and take care of it. So if you're busy and you don't have time to sit and wait, you need to get a hold of me and you need to get the answers taken care of right now, because you've got so many responsibilities in life and you've got so many people that you answer to and who answer to you, so that your day is swamped. This is probably for you, and it's worth the money.